I'm going to jump to the individual questions because I think some of these are pretty interesting, if that's okay, in the interest of time. So I'll start off with you, Ben, first. So I have to ask you this because you're the former physician to the last two presidents. So you served under President Obama and President Trump. The president have asked you uh, about something like this? We have asked you for your advice, and did President Obama ask you about the Ebola crisis, or and if so, what would you have advised them? And same thing with President Trump.
Yeah, there's a pretty big line between the political nature and the medical care kind of at the White House. And so we mostly stayed in our lane and made sure we were just taking care of their medical needs and the staff needs. And obviously they would, they'd ask you questions or sometimes get your opinion on things, but most of the time you really were just advising on the day-to-day healthcare, which was enough of them and whether they should be tested or cared for, and all the staff and how you're going to protect them. And so you really concentrated around that, and it really didn't blur the lines with politics too much. I know it's hard to believe, but it really was true. You kind of really stayed in your lane. And so that's how we handled while we were there.
Good to know, Ben. I had to ask. Rick, maybe we go to you next. Working, you do a lot of stuff on occupational medicine, and just curious what your thoughts are. Challenges, opportunities when it comes to OcMed. A lot of people are trying to get back to work. Even today, I had one of my physicians ask me, what type of testing we should do to get some of our staff member. Curious to hear what you think about this in the OcMed space.
Yeah, absolutely, David. A really, really good question. We might have more questions than answers right now, to be honest with you. As we reopen the country, you're going to have small businesses, except for New York, Frank, I'm sorry. But, you're going to have small businesses that would have a good preparedness plan and contingency plan if there is any outbreaks. And we're looking into who really needs to be tested. We are working on following CDC and OSHA guidelines. So currently, if a healthcare provider, if you don't have a test strategy available, it depends on local and state as well. So if somebody who was known positive to COVID-19 and now wants to go back to work, or somebody who is asymptomatic and now the employer wants this person going back to work, do we get them tested? So there's a lot of questions out there right now, Dave, that we're working on to make sure that we have a good plan in place. But to be honest with you, we're following a lot of CDC and OSHA guidelines with this.
David,
and yeah,
if I could just, so Alex has greater insight onto this. I think it speaks to, when you start reopening the U.S. economy, I think one of the first things that we really have to look at is, the elective surgeries, the electives, everything that got shut down in healthcare, because you really having healthcare viable and strong is important. And I think one of the first things we really have to look at is restarting elective surgeries and surgery centers and outpatient facilities, because right now, even in New York, we're having difficulty. I could take care of that, Colles fracture, I can splint it up, but you need to have follow-up care for that. And there's only so much you can do on a telemedicine visit. All these pent-up elective quote unquote surgeries of, biliary colics or cancer surgeries or cancer treatments and stuff like that. These are largely the things that the hospitals that's been their bread and butter, and these multi-specialty groups, that's been their bread and butter. And unless you start these really soon, you are going to have a lot of people, even in the healthcare sector, that are going to be financially strapped. And so I think we really have to look, nationwide in terms of, how do we get this part of healthcare up and running again so our healthcare remains strong so it can take care of COVID or non-COVID related issues. I think it's very important that we start seriously looking at how do we reopen the rest of healthcare as quickly as possible. It's one thing that we have to look at, and it doesn't get a lot of play because people don't understand the dynamics or the economics of healthcare as an industry, but it's fragile right now, and a lot of people in the healthcare industry are hurting because of everything that's happened over the last, maybe two months or so.
Frank, I just got to really piggyback on your elective surgery. Here in Arizona, the governor has approved elective surgery starting May 1st. And we are going to be starting, and I have a bunch of surgeons who actually came to me and discussing about how do we manage asymptomatic COVID cases. The symptomatics are the easy ones, but those are the other questions that will come up when we open up and do these kind of things. And, do we do testing on these folks? Do we not? Do we
Sure.
do just
Yes, you do.
control protocols? Infectious control protocol. So there's a lot of these questions coming out as we reopen. So just, putting it out there that we might have more, not have enough answers yet. But that's one thing I just wanted to mention as well.
The good thing for society is all of us are in great position to do the tests, to see these people, and to help the system as a whole. I mean, we got a lot of centers right here that we know what we're going to do, and so it's U.S. is set up well because of all of our centers right here. So I think it's promising going forward.
Yep. Exactly.
Plus, we know how to protect ourselves. That's the whole thing. I mean, you have to teach everybody, even let's say our elective, our surgeons, the general surgeons, orthopedic surgeons, whatever it is, we already know how to protect ourselves and protect our patients and assume that everybody is COVID positive and take the appropriate necessary measures to make sure that the infections are controlled. These infection control procedures are what we teach every year to all of our people that we work with. And so it's just a matter of emphasizing and making sure that everybody gets it right every time so nobody gets hurt.
I believe California is already working on testing asymptomatic who are high risk already. The governor has already kind of approved that. So it's coming on that.
Very good points all around. I think just the last question is just about the future. They say that I think the CDC director mentioned that in the fall it's going to get worse. There's a second wave, and couple that with the flu. Are you guys nervous? Does anyone want to take that on?
Well, to be fair, he said more complicated, not worse. So he did clarify that the next day. I don't want to get Dr. Redfield in trouble, but if you look at history, these pandemics, they have multiple bumps, and this I think is the first bump. And if you look at the pandemics in the past, the second bump is often much, much bigger. And so that's my big concern is, we now know I think we underestimated our enemy the first go around. I think we didn't prepare as well as we could have, and we all own part of that. I think we have to get our PPE in order. We have to get our testing in order. We have to get our protocols in order. And when this comes back in the fall, hopefully that, we are better prepared to handle whatever it gets thrown at us. But I'm concerned about a second bump. Yes.
Yeah, and I think that's why these are important for us to talk about it. And, New York is a lot of smart people and dedicated people doing what they're doing, and the lessons learned out of New York and information sharing is just going to help us prepare in the other regions when we start to face different things. And so, I have a lot of appreciation for our colleagues in New York and some of the higher areas that are, going through this and sharing information and not being secret about stuff, but being open about their successes and their failures, because that's extremely important for this nation.
I wish we had a crystal ball for the first one. We all wish that, but I think now that we're here, like, kind of Frank said, we just got to prepare right. We got to test more, isolate those folks, contact trace. We need that contact tracing army. I think in every state, not only New York, we need that army, make sure we're prepared appropriately, and we could tackle the beast, to be honest with you. So it's all about how planning and preparing. And if we do this appropriately, I think we'll be.
Thanks, guys. Any last word before we wrap? Hey, listen, guys, thank you. There's not a lot of publicity about urgent cares, but I think urgent care is really bearing the weight on its shoulders to lower the number of the patient volume in the ERs, and you guys are doing a great job in the front lines. You're supporting the rest of the healthcare system. Lots of staff members, lots of physicians and clinicians involved, and you guys are the leaders leading the charge. So thank you very much, and I hope to do this again.
Yep. Thanks, Dave, for having us. Thank you.
Thanks.
Thank you.